All right, welcome back to the Living Life Well show. Today's episode is going to be a little bit different. It's actually an episode that I recorded with Dr. Samir Islam of Lubbock Gastroenterology. He has a podcast called Let's Talk About Poop. I promise might be a little bit of talk about that, but primarily it's focused on how medicine today is really kind of falling behind, how we do things differently at Live Life Well, and some steps that you can take to help educate yourself. Or if you're a healthcare professional, some of the resources that I've used to really help me start on this journey to helping people harness the power to heal. So, without further ado, here you go.
So on today's podcast, we had the pleasure of having Dr. Jon Skelton on. We had a fascinating conversation. We talked about ways to naturally reverse diabetes, Dr. Skelton's program at his office and his clinic, and ways that he approaches treating patients as a whole and treating them naturally, including dealing with sleep, diet, and the spirit. So tune in. Great podcast, a lot of practical tips that you can take home today. And I would encourage you to visit Dr. Skelton's website and his clinic to get more information and to book your appointment today. Well, Jon, I want to thank you for joining us on our podcast today. We have Jon Skelton here, who you have a very interesting transition in your career. So tell us a little bit about what you were before from an ER doctor and what made you transition into your clinic that you're in right now.
Yeah, so thanks for having me on, first of all. I really appreciate it. So I started out in medical school thinking that I wanted to be an orthopedic surgeon. Quickly realized that I really like the ER aspect. I like the fast pace, all the different procedures that you get to do, and those things. So I went into emergency medicine, did my residency at Scott and White, quickly moved back here to Lubbock, and worked at Covenant Medical Center for about 11 years. Got into the administration with it a little bit, but quickly realized that traditional medicine, the way it's set up, is just not really helping people get what they need. And so that led me and a few partners to start Star ER back in 2016. Thought I could help a little bit more there at Star, and I do believe I can, and I still work there at Star. But I realized that there was still a big hole. We were still seeing a lot of the same patients again and again, primarily patients diagnosed with chronic diseases like, diabetes or kidney disease, and coming in repeatedly to the ER,
Yes,
not to the primary care
yes.
physician.
It's also like the ER becomes the primary care place for a lot of people, unfortunately.
Right. And I also like to tell people too is my wife has been on this more, back, 10, 15 years ago, I would have called it granola kind of healthcare kick, but she was about doing things much more naturally and, really eating right, exercising, doing these things as a lifestyle as opposed to, hey, just pop a pill for that, which is what we were taught in medical school and in residency for the most part. So that, and then the COVID blow up really kind of opened my eyes that there were a lot of people that were telling me repeatedly things that I would tell them in the ER. They acted like this was just brand new information, and I just thought that can't be the case. And so after hearing that over and over again from patients, I decided to start Live Life Well Clinic in 2021.
I'm curious, what was kind of the impetus that you notice in the ER that like, man, the system's broken. Like, what can I do? Because obviously, in my clinic as well, I see this all the time where we see patients coming in for recurrent GI issues, nausea, vomiting, GERD, abdominal pain. And I can see the system broken. We're not getting down to the root cause of what is going on. So what did you notice in the ER that made you think, hey, something's got to change? Like, what was that impetus moment?
Yeah, so really, it was repeatedly talking with diabetics that I saw that were progressing from diabetes to now diabetes with renal insufficiency to now diabetes with renal failure. And I would discuss, what they were doing. Now, granted, some patients were just non-compliant, meaning they just really weren't doing anything.
Yeah.
But there were plenty of others, and the vast majority is what I would say are actually trying to do what they know to do. And quite honestly, the information for them that they were getting imparted to them was just lacking. And it's not because of the physicians were bad physicians or anything like that at all. It was simply because there is so much information that has to be imparted that the system as a whole is not set up to be able to educate the patient in a way to be able to allow them to take control of their health. And that's what I was seeing over and over again in this unfortunate progression that patients were going through. And as I would try and impart just a little bit of information in that emergency room setting, they repeatedly told me that, this was new information to them. And I thought that can't be. It just seems so basic.
So how is your clinic different then? Like, how is it different from, like, let's say a regular primary care doctor who you're going to see, who these patients, normally see? Like, what makes your clinic different?
Yeah, so first of all, every appointment is from an hour long to as short as 30 minutes.
Wait, an hour-long appointment?
Yeah,
Because that's very atypical. Obviously, it's
Yes.
very hard to do. So the patients can get the time to see somebody and actually spend the time with you.
Yes. And part of the reason is I go outside of the insurance model. If
Yeah.
I was within the insurance model, no, it'd be about
you
10
can't do it,
minutes.
yeah.
So at best. And the reason it's an hour long is because of what I just mentioned. It takes a lot of time to A, understand what's going on with the patient, and B, really help guide them through the different modalities that they could implement for themselves to really help take control of their health.
So what are those different modalities? Like, what exactly do you teach someone who has diabetes to actually be able to reverse it to make them not have diabetes? What is that? What approach do you take?
Yeah, so it's a multi-pronged approach. So of course we focus on diet, we focus on lifestyle, and lifestyle means a lot of things. Lifestyle doesn't mean just what type of workout you're doing, how often you're doing it, and those things. Lifestyle may mean what your bedtime routine is, how you start and end your day, how you actually even approach your meals. Do you drink water with your meals even? We get very, very detailed depending upon the patient because our goal is to help them have the most amount of knowledge and be able to determine for themselves what's really moving the needle.
Wow. So in this approach that you take, like, do you actually give patients like a step-by-step guide? Like, what exactly occurs in these conversations? Do you just ask them, what approach that they do, or like how do you actually practically do that? 'Cause it's hard. I'm
It is.
fascinated by this because
Yeah.
in our like 10-minute conversation that we have with patients for 15 minutes, we have all this information that we want to give. I want to talk about lifestyle changes, dietary changes, sleep changes.
Yeah.
But I can't do it because it's so constricted. So how are you able to approach that? I know you have a longer time, but like, how do you practically do that?
Yeah, so I think it's twofold. I think information is king. So number one, I have about a 45 to 50 page intake form
Yeah.
that helps me direct testing because I think the more information we can get up front really helps us know exactly where to go. I kind of get that from my ER background. We like to cast a wide net when a patient comes into the ER. And so I take that approach in my clinic as well. So we start there. Then once we have all that information back, that gives us tools to then go and be able to implement and discuss with them. We are going to take the most necessary tools first and implement those, typically going to be dietary related. And then I have a course that I've developed that walks patients through the different things that we're going to have them transition through over a period of weeks. And then as they go through that, we're able to communicate back and forth, and we're able to tweak it to them to personalize it.
So it's not obviously a quick fix because diabetes is not a quick fix.
No,
It takes years to
yeah,
get there, so
yeah.
it may take some time.
Yeah.
What have been some of the more powerful things that your program has done that you can say, hey, these are the kind of the biggest buckets that we can pull upon to reverse diabetes?
Yeah, number one is understanding what sugar is and what it isn't.
So what do you mean by that?
Yeah.
Because we hear about this. Like, what do you mean by that?
Yeah, so kind of the standard approach to diet is people think you just need to eat healthy. Well, what does that mean? For the longest time, we thought it meant low fat. Diet Coke was great, and and all these things. Well, what we don't realize is that things that say zero sugar or natural flavors or low fat, typically there's hidden sugars in there. And so if you go even on the CDC website and look at all the different names for the names for sugar that they put on the back of labels, there's 30 plus different
Oh
names
my gosh.
there. And so what we know, and you know this just from your work with being in the GI system, the pancreas is so responsive
Yeah.
to anything that we eat. And so when we drink a Diet Coke, it tastes sweet, right?
Yeah.
Well, the pancreas is responding to that sweet, and so it secretes that insulin.
Yeah.
And so that's why we don't really see any change significantly for most people that drink Diet Cokes versus regular Cokes
Yeah.
because they're still getting that pancreatic response.
Yeah.
Well, what happens is obviously that insulin secretes, it drops that blood sugar, makes you hungry.
Yeah.
So you start eating more.
Yeah.
And so when we think that we're eating healthy by getting something that's zero sugar, we're really not helping ourselves. And so really understanding what sugar is and isn't. And so for a lot of diabetics, they think, oh gosh, I cannot eat an orange. I can't, eat an apple. Those things have too high sugar in it. And then you really just need to understand your serving size, your fructose guides, and don't need to count carbs or anything like that. It's more about understanding what really is in your food.
Yeah.
So,
Yeah, I think a lot of us, I think more unfortunately, us in the medical field, we don't know. We
Yeah.
don't know what's in our food.
Yeah.
We've never, I've never gotten a nutrition class. I've had to learn this on my own,
Yes.
as you did
Yes.
as well.
Yeah.
So how are we able to gain this knowledge? Like, how are we able to really understand we are what we eat and these things actually matter?
Yeah, well, looking at it, and I try to take everything from a biblical lens.
Yeah.
And so I'm a Christian, and I look at something called the law of first mention in the Bible, which means that it's the belief that when God tells us something the first time, He's always going to give us His best first. Well, when we go into Genesis 1, the first thing He tells us to eat is actually vegetables. It wasn't until the fall, until Noah came out of the ark, that then He tells us to eat meat.
Yeah.
And so when we look at that, and then we look at what food really is, and we look at whole foods, we find that there are very, very few whole foods that diabetics need to stay away from.
Yeah.
When you're really, truly eating whole foods, they are truly nourishing because they have such vitamin and nutrient-packed resources to really help the body digest and rest and heal.
Yes. I think people underestimate that aspect because whole foods are whole foods. I mean, it's not like you're eating half foods or quarter foods. They give you pretty much everything that you need. And I find this as well in the GI space, where if people actually eat real whole foods that is not processed, full of things that are not natural, they'll feel better. And they're amazed by how much better they feel.
Yeah.
So you mentioned food and diet as one aspect. What are other aspects that you have found as part of your program to help reverse diabetes?
Well, one of the big things, you mentioned, sleep.
Yeah.
Sleep is really, really big. Most diabetics are obese, and we know that obesity also can lead to sleep apnea. And sleep apnea really drives our cortisol response, which helps keeps blood sugar high, which keeps our pancreas pumping out insulin, keeping our insulin resistance high, causing our blood sugars over time to continue to go higher and higher because it creates this inflammatory state. And so I see that sleep is a really big issue. And even if it's not sleep apnea, just generally not getting enough sleep or not getting into deep, restful sleep. And so looking at those aspects is important.
So how would somebody know, or a patient know, if sleep is affecting them? Because there are a lot of people who think they sleep well, but they actually don't, but they don't know. So A, what are some telltale signs that patients can understand, hey, sleep may be playing a role in terms of my appetite? And then B, for selfish reasons, what can I do to improve my sleep?
Sure,
Like, what are some tips that you have for that? What's worked?
Yeah, so a couple things. One, I think cold is underrated. I think you want a very cold, dark, and quiet environment. So that's number one. And so you want to cool your room down to about 66 degrees. If you can stand it, I also recommend that you do a cold shower right before bed. It doesn't have to be long, about 30 seconds to a minute, and it really doesn't have to be that cold. I'm not talking about cold plunging down to 32 degrees or anything like that. But a shower that's about 66 to 60 degrees, that helps to calm the nervous system overall and put you in a more restful state to be able to get into those deeper cycles of sleep as well. So I recommend that. I also recommend cutting off food and water at least 2 hours before bed. The older you are, the further back you may need to cut that off as well. Partly because we really want to focus on giving the gut a rest
Yes.
and turning off the gut and letting autophagy take place so that we can rest and repair.
John, that's like music to my ears. You're exactly right. Because people, I think, underestimate that aspect as well. That if you eat late at night, your body is still digesting that food. It doesn't go away immediately. And this is why our recommendation is always, wait at least 3 hours after you eat before you even lie down. So explain autophagy. I can't say that word correct. Explain what that is to our audience and how important that is with respect to improving your life and living and things like that.
Well, so when the way I'll go about that is I'll kind of take it in reverse. So I like to think of it this way. So in New York City, I can remember years ago, they had a sanitation worker strike. Well, what happened? New York City was a complete mess, much more so than usual, because nobody had any place to put their trash. So it literally just piled and piled up. Just created an environment that was just, for lack of a better way to describe it, just very smelly, if nothing else, but also just a very sick environment. Well, when you constantly feed yourself, you are doing just that. You're just piling up the trash of your cells within your body, but never allowing the sanitation system to come in and clean it out. And that's what autophagy really is. It's really cleaning out all the trash and all the dead stuff that are in our cells, specifically in our gut, really is where we're talking about, but really your entire body. And so it is very important to take place. And if we're constantly eating, we can't do that. And so that's where that minimum 2 hours, I generally recommend 3 hours or more. And really, if you're looking at doing intermittent fasting or something like that, we like to have you cut that off by about 3-4 o'clock in the afternoon.
Yeah.
So.
I that's exactly right, because the buildup of waste in your gut is real and it
Yes.
happens. And this is one of the reasons I truly feel like that a lot of people have their GI issues, bloating, nausea, distension, that the change in the gut microbiome, the change in the bacteria, it all is one big conglomeration going on in your gut. And by doing things like you're recommending, not eating late, doing things that can improve your sleep, which people don't realize that sleep is critical for gut health.
Right.
You're setting yourself up for failure. Spiritual, let's talk about that, because you
Yeah.
mentioned that before, and I think that's an important part of your practice, and I think it's an important part of people's daily lives. How does that play a role with how you treat patients, but also with the wellness of patients?
Yeah, so I, approach it from a Christian perspective. However, what I will say is that all these practices that I have people implement, regardless of whether you're a Christian or from a different religious background, will all benefit you. Because a lot of the practices that we're implementing is slowing down in life. Things like before your feet hit the floor in the morning, practicing gratitude, or even doing some deep breathing, switching from that fight or flight autonomic nervous system to the parasympathetic nervous system to calm, because our society today is so busy, going, going, going. We're constantly in a fight or flight mode, and we don't ever really see that spirit, mind, body connection. And it really is there. And, I think if people will slow down enough to implement some of these things, they will really see how much of a benefit it is. Things like meditation, and meditation doesn't have to be long. There's been multiple studies that showed that people with high blood pressure and even people with blood sugar issues that once they practice meditation for maybe up to about 15 minutes or so, which is a longer practice, they start to be able to wean medications
Wow.
in many instances. And so it's just amazing that spiritual connection. And as a Christian, I think when you can pull in that spiritual aspect to it, then you just even get greater benefit.
So we mentioned sleep, spirit, diet. What are some of the pillars that you've realized that can help patients reverse their diabetes naturally, almost like naturally?
Yeah. Well, and one of those pillars within the spiritual actually is fasting too.
Ah, let's talk about this. I love this. Yeah.
Yeah. So, fasting, virtually every religion, uses fasting. I think fasting is very important. But people don't really understand how to do it, or, oh, a juice fast is great, or, I can just, do this or that. Well, fasting to me also includes what your inputs are. Your inputs are things that are
Oh,
coming into your eyes or into your
yeah.
ears.
Okay.
So,
So tell me what you mean by that. Are you talking about maybe social media, the inputs from that, or what do you mean by that?
yeah, absolutely. So a lot of us are wired and curious, and so we're listening to things all day long, and we are creating for ourselves a sense of confusion because, hey, listen, I have a podcast, you have a podcast. There's so many podcasts to be able to listen to out there, and there's so many interesting people.
Yeah.
But at the end of the day, if you are doing that from a perspective of just looking for yourself, you can create internal confusion. That internal confusion can then lead to a little bit of increased angst and a little bit of fight or flight, even because you are constantly questioning, am I doing the right thing?
Yeah.
Another funny input with regards to sleep is, I love like James Bond type movies and, whodunit kind of shows and mysteries. And so I've noticed that if I watch that right before I go to bed, I just will not sleep as good.
Yeah.
So I've got to really look at all my inputs. What is coming into me visually, auditorily, in addition to food, but really looking at those inputs and taking an inventory there.
So how do the GLP-1s play a role in your practice and diabetes? Because, we have plenty of individuals who have a pill
Yeah.
that can really affect with weight loss, but you have to be on a pill because if you get off of it, we know what's going to happen. You're going to regain the weight. And so how do you navigate that aspect of, you have kind of an easy road versus a more difficult road with what you're recommending? How do you navigate that with patients, or how do you navigate that with your practice?
Yeah. So currently, I am very, very reluctant to prescribe GLP-1s, primarily because most people want just that.
Yeah.
And the problem is that once you're on that, and if you're not choosing to implement any of the other things, you've essentially said, I'm going to be on this, for the rest of my life. We know that there's a fair amount of side effects associated with the GLP-1s, and they're not insignificant. As a ER doctor, I see this, every week, so I know that there's significant side effects, and until recently, it was an injectable medication that had to be in for an entire week. And so patients, if they do have symptoms, suffer with that for 3-4 days. So my approach is always to take what I've lined out first and then back into a GLP-1 aspect if it becomes necessary.
That makes sense. Okay. So we talked about, the spirit, sleep, diet. We kind of touched a little bit on the medications. What other aspects of that you have found that have been very helpful for patients to reverse their diabetes and to do it in a way that's long lasting? Like, what other tips would you kind of put into your practice for patients who come to see you?
Well, so one of the first things I always start with is you have to have a vision. And by vision, I mean, why are you even doing this?
Yeah, you're
Right?
why. Yeah.
Yeah, because if you don't think about that, the things that I'm going to be asking you to do when I take away your favorite food, or ask you to do something else like limit social media, those can be very difficult. And so if you don't have a why that's bigger than yourself, it really becomes very difficult to do that. And so we start there. because, a lot of people can tell you, hey, I want to lose weight, or, I want to go on this vacation. But what does that really mean for you? What is your vision? I know that's your goal, but what is your vision for your life? What are you able to do on a daily basis, weekly basis, yearly basis? And so I think starting there is important. Then that gives us kind of the fuel to move forward and push through when we do encounter some of those hard things that we'll be talking about. But then we also take it as a stepwise basis. I don't believe in just completely ripping the Band-Aid off and implementing everything at once. I think you need to do it in a stepwise process.
So have you had, how has been your success with this program? It sounds incredible. It's natural. It has a good scientific backing behind it. It's hard. And
Yeah.
so how successful has your program been? Like how have people done?
Yeah, so interestingly, I've had a client recently that, came to see me. Fasting blood sugars were 340.
Wow.
4 weeks later, 140.
4 weeks later.
4 weeks later.
Wow.
Now blood sugars are around 120, 130. And we're still working, but no medications, a couple of directed supplements, but primarily support of a good wife and family. And that's another thing with my practice is I always think it's very important that if you are in a committed relationship, that you have that significant other with you there at the initial appointment so they know what you're getting into too. Because while I can help, you need somebody else that's there with you every day who's on the same page. And I think that's a real key is you essentially have to have community of some support to be able to implement the things that I'm going to be asking you to do.
Yeah, because it's not just a one person, lone ranger here. I'm gonna try and change, because you have temptation everywhere, and if you don't have a full family with you,
Yes.
It's very difficult to do this on your own then.
Yeah. And when it's constantly in your pantry and fridge,
Yeah.
that makes it a little bit more difficult. So,
What are some of the challenges you've had in terms of having a practice like this? Because it seems like a lot of people would want to do this, but not everyone's obviously being able to have that time or to see you. So what are some challenges you've noticed that are a little bit more difficult to overcome?
yeah, so just the insurance aspect of
Yeah,
things,
such a
right? So,
pain. Oh my goodness.
not taking insurance for my services can make it a little bit difficult. Now, typically for the vast majority of the blood work, you can utilize your insurance for. There's some other testing that we may need to do that insurance may not cover though. So that can be, one hurdle. And so I try to give different options for people to be able to come into the practice. I even have a course that if somebody, wanted to just purchase that and try and go through that. But what we try and do with that even is create community. So every so often we'll have a live Zoom call for people to come in and be able to ask questions. And so whether it's 2 people or 20 people, that doesn't matter. Whoever shows up, and we'll get to everybody, and then we'll get a question in. So,
Wow, that's great.
yeah.
So what has been, if we can give some tips to our patients who are watching and say, if you can hit some of these buckets, this will be a good starting point. Practical tips that patients can take who are watching or listening. What would be some of those tips, maybe in some of the different aspects that we talked about?
Yeah, so number one is define the names for sugars and learn to read labels.
Yeah.
And learn where the important section is. The important section is not the calories, not the serving size, not the protein, not the carbs. It's that big paragraph of words you can't pronounce underneath. That's where the important part is. And so really, if you're just eating in the edges of the store, staying in the produce section, the butcher section, maybe a little bit in the dairy section, you'll be fine. When you go to that center of the store, that's where you start having to read labels and really have to educate yourself. So number one, define what sugar is, learn to read labels. Number two is you really need to work on your sleep. And so that's going to be the second thing. If you can get a continuous glucose monitor, that will help you right there, because if you are waking and your blood sugar is higher in the morning than when you went to sleep and you haven't raided the fridge overnight, then you have a sleep issue. Your sleep is dysregulated in some way. And so that would be a big help. I think a continuous glucose monitor can help with that, but it can also help with the individual choices, even if you are eating in the edges of the store, to help you determine what is best for you, because it's going to be a little bit different for each individual. And so I think those are two big things. And then the next thing I would say is, you want to maintain a 12-hour fast every single day, minimum. So whether you're on medications or not, if you are on medications, this is where it can become a little bit sticky, because if you're used to, having to take that little bit of food before bed because your blood sugar drops, well, what that means is that we need to back off on the timing of the medication and or dose before going to bed. And then what we can do is we can institute that 12-hour fast so you can actually get some autophagy and cleaning out of the GI system.
So the 12-hour fast, are you suggesting, how would you do that fast, for example? Like, is it from whenever you wake up until 12 hours later, or does from dinner up until you wake up, or how would you recommend that to a patient?
Yeah, so basically what I recommend is, if dinner's at 7 p.m., fast until 7 a.m. the next morning, and do that 12 hours overnight. And so usually that's not too bad of an adjustment for people. It may just mean cutting off that last Diet Coke, or, whatever it may be after dinner that you have, and just consume water at that point. So
have you done your protocol on yourself?
Yes, I have, actually.
And what changes have you noticed with yourself?
Well, interestingly, the vast majority of the changes were twofold. One, in gut health, just from bloating, belching, gas, those things just really improved. And then also just clarity of mind, really improved as well.
So what do you mean by that? What do you mean clarity? Like, did you feel more brain fog before, or kind of what did you?
Yeah, just kind of waking up in a little bit of a haze in the morning, and kind of feeling like you kind of just have to shake that off. But no, now I find that when I wake in the morning, that's my most creative time of the day, and I'm able to get the most done in those first few hours in the day. Whereas before, I felt like I had to, wait for my coffee to kick in to really do much of anything.
Wow.
So.
Now, you mentioned earlier today about selected supplements. So tell me your thoughts on supplements. How do you approach supplements in your program?
Yeah, so my whole approach is, I want you to get what you need from diet and lifestyle first, supplements second, and medications third. Because you can't out-supplement your way out of a chronic disease, just like you can't out-diet your way alone out of a chronic disease, or out-exercise your way out of a bad diet. So supplements need to be targeted, but you also want to make sure that they're high quality and useful, of the right variety, so that you can really get the most out of your bang for your buck.
Yeah.
So
we have also in our audience who listen and watch a lot of healthcare providers who are seeing a shift in how they want to approach medicine. They want to do a holistic medicine. They want to treat patients like they should be treated, get down to the root cause and get them feeling better. I'm fascinated by your approach and how you did this. How did you learn this? What did you read? How did you learn this? How do we get more knowledge on this? Because I don't think you're alone in doctors who want to do this.
Yeah. Well, I found the American College of Lifestyle Medicine, ACLM. I think that is a very good resource. They literally have a course on their reversing diabetes. They also have a course currently on blue zones. And so I would recommend both of those courses. I think they're very good. For somebody that wants to go into a really deep dive, the Institute of Functional Medicine would be a good resource to look at as well. Those would be the two big ones that I would recommend. And then, just start being curious. Just really start, looking for yourselves, can actually diabetes be reversed, and what does that even mean, really? And so, for the lay people out there, generally what we're talking about, and when you use the medical term, it's really more remission is what we call it. You might hear that with cancer, but basically what we're saying is that when somebody reverses their diabetes, their A1C has come down below 6.4. And if they have pre-diabetes, then that would be in the pre-diabetes category. And then once you're at 5.6 or less, then you're considered to have no pre-diabetes, no diabetes at that point. And that's really what we're talking about, is that diagnosis that we get at for diabetes.
So if a patient wanted to come see you, or if someone is interested in learning more information about you, where A, are you accepting new patients? And then B, where can they find you?
Yeah, so the easiest way is to go to livelifewellclinic.com/book, or you can just go to livelifewellclinic.com and click on book a discovery call. It's a free call. It's 20 minutes. It lets me learn a little bit about you. You learn a little bit more about me, because I know this isn't the right approach for everyone, and I can't help all the things out there. But it lets us have that introductory, no pressure. It's just a phone call. And then from there, if it sounds like it's a right fit, then you can make the decision to move forward from there.
I'm really curious about sleep,
Uh-huh.
because my sleep has always been terrible, and I've been trying like the darndest to improve my sleep. And I've done the things like cool bed, dark room, but the problem I have, which I think a lot of people have, is that my mind just doesn't turn off. Like,
Yeah.
it's constantly on, and I have a shutdown routine. I don't do social media at all. When I get home, I focus on my family. I just can't shut it off. Someone like me, type A, always on the go. How, fix my sleep. Like, what do I do?
Yeah. Well, so sometimes I really look into magnesium. I look
Okay, yeah.
at magnesium. I look at it a couple different ways. I look at it as serum magnesium, and then I'll also look at red blood cell magnesium. I look at both.
Yeah.
So red blood cell being obviously kind of more total body magnesium,
Yeah.
and the serum magnesium. So I look at that.
Yeah.
And then generally make recommendations based on that. If somebody is having a mind that's going a little bit more, I may lean into maybe magnesium 3 and 8, L3 and 8. Or, we may go, if you're dealing with more pain, we may look at magnesium glycinate a little bit. And so that is one. But interestingly, I also look at B vitamins too, and see where your B vitamins are. Sometimes if you've got a little bit of a B vitamin deficiency there, it can create that kind of mind going and those things. In addition, we're also going to look at your cortisol over 24 hours and see if you're having an extra large bump in the evening that may be causing you to wake up as well.
So we say B vitamins. Is it all the B vitamins, or like B12 specifically?
I look
or
at B12 and folate
Okay.
primarily,
Yeah.
and then B6 sometimes as well.
Yeah. So what are your thoughts on, because you mentioned some of these sugars, and you mentioned artificial sweeteners. So, in the GI world, we have kind of a debate in the GI world where, a lot of the papers on artificial sweeteners in the gut microbiome do show a change in the gut microbiome with respect to that. What we don't know, or what the debate is about, is, does that matter? Like, who gives a flip, in essence?
Yeah.
You're changing, are we focusing too much on the weeds and not the actual forest? What are your thoughts on that? What has been kind of your experience with individuals who switch from Coke to Diet Coke? But you mentioned kind of still the insulin is still there, and they still have that craving. Like, what has been your experience with that?
Yeah, so what's interesting, it does take a while to shut off the sugar addiction. I mean, the sugar addiction, whether it's pure cane sugar, or whether it is aspartame, or monk fruit or stevia for that fact, basically it all is going to trigger a dopamine response. And that's really what we're addicted to. The vast majority of, I think, all addiction in our society today is primarily, it's a dopamine addiction. It's just the route that you are choosing to get that dopamine hit. And so really you kind of have to go cold turkey, for a period of about 4 to 6 weeks. And then you will actually taste that, a strawberry is sweet without having to put syrup or sugar on it. And so those taste buds will change, that response to the sweetness will change, but it does take time.
Yes. Okay, that makes sense. Do you have any thoughts on coffee?
Yes, I like coffee in small quantities. However, there can be mycotoxins in the coffee, and so typically, if you're going to do coffee, you want to limit it to a certain degree. And if you have certain infections like H. pylori
Yeah,
and those
exactly.
things, you may want to completely stay away from it, at least for a period of time. But coffee can be good as long as it's black coffee.
Black coffee, yeah.
So,
So in your coffee, for example, or the coffee you recommend, you don't add any artificial sweeteners,
correct.
and certainly you don't add any milk or creams
Correct.
or things like that.
Yeah, it took me about 3 months to be to stand that, but I pushed through and, made it to the other side, and so now I can drink black coffee. But yes, that's really about the only way to do it. So
So you bring up an excellent point because in the GI literature, in the liver literature, all the studies on coffee are fantastic, but it's black coffee.
right.
It's not the coffee with artificial sweeteners. It's not the coffee with sugar, cream. It's got to be black. But the black coffee has been shown in the GI stuff, in the GI space, decrease your risk for fatty liver disease, decrease your risk for colon cancer, increase motility. So I tell my patients, if you're gonna do something naturally for your liver, black coffee, but it can't be this Frappuccino,
Yeah,
Starbucks, yummy.
yeah,
No, it can't be that.
yeah. 3
It,
pumps of
exactly.
vanilla,
Yeah,
and
it doesn't
yeah.
work, bro.
So
Yeah,
yeah, yeah.
exactly right. Let's talk about really quick, a little bit more about diet. So you mentioned kind of the whole foods. What specific whole foods would you recommend for patients in general, and which ones would you recommend to avoid? We know the processed foods are not good, but whole foods wise, what's your thoughts on that?
Yeah, so to the non-diabetic patient, everything is open. However, you really need to figure out what works best for you. The approach that I take with that is we eliminate things one at a time over several weeks. And then we had you add foods back in one at a time. See what your GI response is to
Yeah.
that. Are you having more bloating? Are you having, maybe increased congestion? What's going on? But specifically when you're talking about diabetes, the two big things that you want to really avoid is added sugar, number one, and number two, when you're talking about whole foods, is grains as a category,
Yeah.
generally speaking. Even whole grains, because if you go to the grocery store now and you buy something that says whole wheat
Right.
on there, only 51% of that has to be whole wheat.
Yeah.
The other 49% can be just the endosperm, which is all carbs, which for a diabetic, they think, oh gosh, I'm eating whole wheat, but you're really not. you're eating half whole wheat. So, and even 100% whole wheat for some can really help perpetuate that insulin resistance and high blood sugars.
Yeah, we become obsessed with making our own bread. We do
Oh,
this all the
I
time. We
love it.
love it. Oh my God, it's so much better.
Yeah.
And I don't like my family doesn't have a lot more GI side effects. They feel better.
Mhm.
It's people underestimate. I think you underestimate the fact that it says on the label it's healthy or whole.
Yeah.
It's not. It's
It's
it
not.
isn't. It really is not at all. And it
Yeah.
has all these things in there, and you'd be surprised. You're right. When you look at the ingredients, it's like high fructose corn syrup. What? Why is that in
Yeah.
there?
Yeah.
That makes no
And
sense.
bread?
Yeah,
Yeah.
bread. Like,
Yeah.
what do you need
Yeah.
in there? Oh, that's fascinating. What about fruits? So fruits have sugar,
Mhm.
and people understandably may be afraid. Okay, should I have fruits? Is this part of the category maybe I should avoid? What are your thoughts on that?
Yeah, so I like fruits with a caveat.
Mhm.
Number one, you need to understand what a serving size is
Yeah.
for fruit. So I'll just give you an example. So blueberries, it's a cup of blueberries. I believe it's about 7.5 grams of sugar in that serving. A serving size for blueberries is about 7.5 grams of sugar. A serving size for pineapple will have about 4 grams of sugar, but a serving size for pineapple is one thin slice. Yeah.
Oh,
So most people aren't eating an entire cup of blueberries, or maybe a fourth a cup of blueberries if you're having it on like a parfait or something like that. But I don't think I could stop at less than 3 slices of pineapple.
yes, you're
So
right.
so you're getting about 12 grams of fructose there. So I recommend just looking at a good fructose chart and then just comparing serving size and the fructose content, and then directing it there. Draw a line at about 6 and try and stay under that line.
That makes sense. I love your idea of fasting, but not just the fasting of food. I never thought about fasting with your eyes, your ears. That is a fascinating concept I've never heard. I hear all the time, obviously, you should not, you should watch what your inputs are, but putting it in terms of fasting it's incredible. So talk to me a little bit more about that.
Yeah, well, I just noticed for myself, I used to be on social media like vast majority of people, and gosh, I mean, you just sitting here doing this with your thumb, and next thing you know, it's 2 hours later, and you're like, oh my gosh, what have I been doing?
Yeah.
It tends to help, create discontent, whether you really realize it or not. It also disconnects you. We are a people that are meant to be connected. And so even though we may feel connected through things like social media, it just disconnects us. And the same thing, my example with regards to, James Bond movies, spy movies, those things, they're fun to watch, and it may be okay to watch, but we may need to really determine when it's best for us to watch it. Or do we really need to be watching that? Does it just stress me out too much internally? But that, I think, is very important, because we were not meant to have everything that is coming at us all the time. I mean, just in my driving over here at 35 miles an hour, if you go back to the Garden of Eden and, if you say Adam was a superhuman even, Usain Bolt, I think he got up to about, close to, high 20s, maybe low 30s miles per hour in a 100-meter. So we'll say Adam could do that too. I drove faster than that over here, and I saw a lot more whizzing by me, taking in things visually as I was coming through. So we have the ability to, but just because we can doesn't mean we should. So,
What are some meditative practices that you incorporate for yourself, but also your patients? I think some of the things you mentioned, gratitude, prayer, meditation, 15 minutes. Like, what are some practical things that people can do if they want to start this practice now? Like, what would you recommend?
yeah, I recommend box breathing. I think
What is box breathing?
that's really important. Box breathing is essentially you take a slow inhale to the count of 4, hold it for a count of 4, exhale to a count of 4, hold that for a count of 4, and
Oh,
repeat.
box. I see it
So
now. Yeah.
just like this. And so for a lot of people, you can do that with your prayer time as you are, concentrating on, thanking God for different things in your life, or even just, using it for gratitude at that time. And so really doing that, there are apps that help. I mean, Calm is a good app, to use. The Abide app, if you want a biblical-based app, that can be helpful as well. With meditation, they have free downloads on there for like, 2 to 5 minutes. And so just start there. But I think it's very important to start your day and end your day that way as much as possible, because you're setting yourself up for success when you start your day, because you're turning off that fight or flight response when your feet are hitting the floor. And same thing as you're going to bed, you're turning off that overdrive system and allowing you to get into that parasympathetic state, which will really help your sleep.
So do you do that yourself? Like, do you have like a morning and an evening kind of meditation ritual?
Yes, yes, and literally my evening is as I shut my eyes, I will do the box breathing for a few rounds, and just kind of review the day, and what I'm thankful for as I'm just laying there in the dark, waiting to go to sleep.
Wow, that's
Yeah.
great. Perfect.
Yeah. All right, well, that's it for this episode. But if you're in the Lubbock area and you are looking for a gastroenterologist, check out Dr. Islam and his staff. You can go to lubbockgastro.com and get more information there about how you can become a patient of his. Somebody that's interested in all different types of approaches to medicine. And I think that's the most important thing here. So, if you found this helpful, if you found this interesting and want to get in touch with Dr. Islam, you'll see the link in the show notes or in the comments if you're on YouTube. Or if you think what we've talked about applies to you with regards to what we do at the Live Life Well Clinic, I would encourage you to sign up for your free discovery call so that we can find out a little bit more about you and what challenges it is that you are having in your life right now, and some ways in which we may be able to help with that. So, if that applies to you, just click the link and get on our schedule today. As always, if you're enjoying this, we always ask that you share and like and follow and even give us a review. We would love that. So, thanks and God bless. That's it for this episode of the Living Life Well show. If you like what you've heard and want to learn more, or want to know how to put this into practice for yourself, go to livelifewellclinic.com. Until next time, this is Dr. Jon Skelton saying go out and live the truth so you can live life well. The preceding is for entertainment and educational purposes only. It is not meant to be used to prevent, diagnose, treat, or cure any condition. The information contained in this show does not substitute the need for a qualified medical professional, nor is it meant to provide medical advice or services. If you feel information presented in this show may apply to you, we recommend you seek out the help of a qualified medical professional who can evaluate and treat your specific concerns.